Well, it was the night before Christmas. The weather was hot. Anxious Aussies were eager to get their third shot. Then today, an announcement from Gregory Hunt has shortened the window from 3 to 4 months. No.
On a very COVID Christmas came one last stocking stuffer from the government.
We will be bringing forward the eligibility for the booster dose to 4 months as of the 4th of January.
Or to put it another way,
I'm for a booster!
come January 31st, the wait time will shrink again to just 3 months. Now, when the opposition leader suggested the same thing yesterday, Greg Hunt said it was.
Utterly irresponsible, utterly inappropriate.
But way back then, it would have been against the government's advisory body's advice. Today, Atagi's given it the thumbs up.
The information we know, and as I say, it's been emerging only over the last few weeks about the protection of the vaccine. The protection does not completely disappear from the first 2 doses of the vaccine. It wanes over time, hence the time-based change in the boosters.
The changes will see the number of people eligible rise from 3.2 million today to 7.5 million at the start of Jan, and 16 million by the end. But the government insists the increase in demand won't be an issue.
Supply is absolutely not a concern this time round. We have got more vaccines than will be needed.
So perhaps for the last time this year, I ask, will this be the shot in the arm we need to get COVID under control?
Infectious disease expert Dr. Paul Griffin joins us now. Paul, what are the benefits of bringing forward the booster interval?
Well, we still do have more to learn about Omicron, but it's looking increasingly like our protection from our existing vaccines is reduced. And so what we really need to do is give that booster to get that protection right back up. And when we do that, it looks like the protection is similar to what we see with the primary vaccination against Delta. So that's going to go a really long way to make sure people don't progress to severe disease, but also help them not get infected and not pass it on. And as we see this variant spread so quickly around the world, that's going to be vitally important.
Are there any downsides to shortening that window?
There are always pros and cons that have to be considered, and that has been carefully considered in this decision. Some of the cons include the thought that maybe bringing that booster forward might reduce the longevity of protection we get as a result after that. And of course, there are cost and logistical considerations. But also importantly, I think we need to make sure people understand why we're doing this, and that it doesn't mean we're going to need a booster every 3 or 4 months forever. But it's really important to respond to this current situation, to also adapt our response accordingly so that we get everyone as protected as possible.
Is there any reason that you can think of why we couldn't start before the 4th of January?
I think we have to make sure people do understand why we're making this important change, and that it doesn't mean it's going to be a booster every 3 or 4 months. We need to make sure we've got boosters, we've got vaccines where they need to be able to give them out. We need to make sure we've got people there to give them, and also, for example, that our IT systems, the booking systems and the vaccine certificates all support the widespread rollout of these boosters. So there is a lot to be done. So I'm not surprised that there's a small delay in making that change.
Well, I've done the maths, and January 4th is a week and a half away, or 10 days. Now, a lot of people... Thank you very much. I can count. I reckon a lot of people are going to be getting together for Christmas. Big gatherings. Do you think, therefore, a lot of people are going to end up in isolation between now and then?
Potentially, and that's why I think it's been a good move to bring back some simple additional strategies to try and control spread. Masks, for example, will make a big difference, but I also think people need to understand the risks of the next few days and take some simple steps to try and address those risks. Maybe have events outside, for example, and of course, while no one wants to disrupt their Christmas dinner tomorrow, if someone's got symptoms, they need to go and get tested and stay home till they get that result. So we still need to do some simple things to try and control this spread while we do roll out that booster program, which will help tremendously.
Doc, dare I ask, when are we going to need the 4th shot?
The simple answer there is we don't know yet. It's definitely not going to be every 3 or 4 months. This is a change to adapt to the change in the virus that we've seen with this new variant. I suspect it'll likely be a much longer interval. Exactly what that looks like, I'm not sure. In the end, it might be something as simple as having a combined flu and COVID jab once a year. There's lots of good clinical trials already combining those vaccines, and so I think in the longer term, that's probably where we'll end up.
Do you think bringing back the masks is going to impact our numbers?
I think it will help. How much remains to be seen. We need a comprehensive mitigation strategy, but one that's reasonable and feasible at the moment. As I say, high rates of testing, simple social distancing, wearing those masks wherever you can, basically, but particularly in indoor venues with high risk. If we do all those things, hopefully we'll at least reduce the rate of increase, because we have seen a real sharp increase in cases in most parts of the country in the last few days.
Prof, I wrote a piece advocating mandatory masks for today, quoting experts like yourself saying that it would help, and I just got attacked by all these people saying that it's rubbish, masks are useless. What's your message to them?
Look, they definitely help. Of course, by themselves, it's not a perfect strategy. It's not going to stop 100% of transmission. But when we combine that with being vaccinated, simple social distancing, testing and isolating those people that are positive, all those things together will definitely reduce transmission. We're not going to eliminate this virus now. That's very clear. So we're not going to get back to zero. But what we want to do is just stem the flow a little bit, keep that rate of increase down a little bit so that our healthcare systems maintain capacity, and combining masks with a comprehensive yet feasible strategy is going to do that.
Dr. Paul Griffin, thanks so much for your time.
Pleasure. Thank you.
You really would have to think that there's going to be bottlenecks, having brought it all the way down for the booster from 6 to eventually 3 months. I mean, it was a trickle at the start of the vaccine rollout and then it was a real flood later on. So that's why they have to bring it down, so that all those millions of people who eventually got their original vaccines can get the boosters in a timely manner. But this is a political risk for Scott Morrison because he's got, 5 months until the election. If they botch the rollout of the booster that is getting accelerated, then that is potentially going to cost him the election.
But they've got no choice.
Oh, they've got no choice, and it's a good thing to do. But I tell you what, if they got it wrong the first time, there's every risk they get it wrong the next time.
Well, I got mine, baby. Woohoo!
You got your booster?
I got my booster.
What'd you get?
Yeah, I got Moderna.
Oh, you got the fancy European one.
Yeah, I just took whatever. I was like, I'll have whatever you got going in that little
Was it a
size
walk-in?
there, sir.
Was it a walk-in?
It was a walk-in, yes.
Okay.
Yeah.
Because it's hard to get appointments, but walk-ins, I'm hearing, are available. You've just got to do it.
Yeah, you've just got to find the right
You've got to act
places.
like you're supposed to be there, like you're on the list. I
That's
got
not the message.
I'm here for my appointment for my booster shot.